Namaskar, this is Dr. Amit Karkare, and these are the sessions on homeopathic therapeutics that we have been taking. We already have discussed homeopathic therapeutics of enuresis, and this time we are going to discuss one more topic, which is hives or urticaria. Before we start with this session, I think it's better to be clear that these videos are meant only for the use of homeopathic professionals, and these are only for educational purpose. So somebody, if they want to try these remedies, it will be completely their responsibility. Homeopathic professionals, people who have studied homeopathy or who are studying homeopathy, they exactly know that how to use these remedies. So if you are not aware about how homeopathic medicines are prescribed, how they are selected, and then if you try these remedies, it will be completely your responsibility. So these videos are only for the educational purpose, and they are primarily for the use of homeopathic professionals. So homeopathic therapeutics, hives, uh, or urticaria. Urticaria or hives or allergic rash on the skin. It's a very common condition that we come across in the clinical practice. And typically during change of weather, typically during a specific fruit season, typically during when we are exposed to molds or damp weather. So there are many allergens, there are many what we can say triggering factors that do lead to urticaria. There are various drugs to which patients are sensitive, they are allergic, so they come with urticaria. So we'll try to see what are hives, what are urticaria, and how we can treat them with homeopathy. It's also called as nettle rash. So if you want to search urticaria or hives in materia medica or repertory, then the word, the word or the homeopathic word is nettle rash. So you can search for urticaria, you can search for hives, you can search for nettle rash. So different authors will have called it differently. So these are typically itchy red bumps or welts or wheals that come on the skin surface. They vary in size and shape. They are typically of an uneven shape, and they can fade on their own. So they come suddenly. So people usually give a patients, they give history that suddenly my skin became itchy. Then there were hives or wheals that came on the skin. It was very itchy. It was burning. It was piercing kind of pain, and typically it was better by applying cold water or ice. The typical causes are allergens. Now the allergens can be different for different patients. So we have the typical homeopathic individuality which is seen in the causative factors. So it starts, the individuality or the characteristicness starts from to be what the patient is allergic to. Most of the patients are allergic to certain fruits, typically strawberries, peaches. People are allergic to eggs. They are allergic to nuts. Typically, there are many kids who are very sensitive to nuts, so they throw an allergic reaction when they are exposed to nuts. So the mothers, they are very cautious that these kids will not eat anything that has nuts in it. If you read, if you check the labels of various bakery products or various food products, they usually mention about whether it has any kind of nuts. Typically in United States or in UK, it's almost mandatory to write down whether that particular food product has any nuts in it. Some kids are so sensitive to nuts that they actually can get allergic reaction even if the utensil that we use had stored that we had used to store nuts earlier. So they are इतने allergic वो रहते हैं. The causes can be thermal, uh, cold or hot weather can cause urticaria. Sunlight can trigger urticaria. Typically, I have seen patients who give a history that they get allergic urticarial rash or hives specifically after exercise or specifically when they sweat. And we have remedies specifically for this condition, that when the urticaria or hives they come after exercise, we have specific remedies for that. Then it can come with pressure or friction. So typically where the undergarments they have a friction over the body, typically where the skin, there are skin folds where there is a pressure or friction of the skin surface, the rash appears there. So just below the breasts, in the groin, in the axillae, so typically, wherever there are, or in the cubital fossa, in the popliteal fossa, so wherever there is a friction or where there are skin folds or pressure, that can trigger articular rashes. Vibration and various drugs. These are various causes or triggers for urticaria. Clinically, one has to see whether it is restricted only to uh, the rash and the itching, or that goes beyond that to give rise to any kind of swelling of the lips or wheezing or lightheadedness, because that can be, or tightness in the chest or abdominal pain or nausea, vomiting. All these things can be critical. So if some of the any of these symptoms they appear, you should rush to hospital because that can be an emergency. People have gone into ICU because the urticaria or the allergic rash or allergic reaction didn't limit only to the skin, but that went with the to wheezing or swelling of the lips and swelling of the bronchial tubes. So that can lead to breathlessness and all. Now, what we should ask during case history, as I discussed in the earlier video, if you read repertory, if you read materia medica, if you search rubrics which are associated with urticaria, then you find what a refined representation we have in the repertory or in MM. If you search materia medica for urticaria, you get specific modalities under in boric, and when you read those modalities, then your case taking also improves, because next time a patient of urticaria comes, you can ask for those modalities. There are various concomitants that come with urticaria. So in boric, especially if you read urticaria, you get specific symptoms in it italics, that urticaria with enuresis or urticaria with rheumatism or urticaria alternating with rheumatism or urticaria or nettle rash with palpitations. So there can be enuresis, there can be rheumatism, there can be palpitations, constipation. The rash can come after fever or during fever specifically, or it can also come during menses, or when the menses are delayed, the patient gets urticaria. So a lady or a girl can give a history, especially a girl who has a PCOD, that her menses got, whenever the menses get delayed by a week or two, she starts getting articular rash. Then we have remedies for that. We get symptoms of cystitis or diarrhea along with urticaria. So you can ask for these concomitant symptoms, concomitant complaints, and that can lead us to those specific remedies. The aggravating factors, typically 90% or most of the patients, they will feel better by cold, but there are patients who get aggravated by cold. So their urticaria, their hives, their rash, their itching, it gets aggravated by cold. So that will be the most characteristic symptom. As I said, exertion is an aggravation for many patients. Specific time of the day, whether it comes in the morning, whether it comes in the evening, whether that gets aggravated by scratching. Now, we haven't written here, but it also can get aggravated by undressing. So there are many patients who give symptom like whenever they undress, whenever they change their clothes, they get the symptoms. So undressing leads to uh, articular rash, or that can trigger articular rash. So that can be one symptom. Usually I ask about whether the seashore or can does that modify the symptoms. A patient of chronic urticaria who gets the hives almost most of the times during the week or most of the times during the month, they can give a history that when if they visit a place like Mumbai or Chennai or Goa or Konkan, wherever there is a seashore, whether there is a hot and humid weather, the urticaria can either get aggravated or it can get better. They give a specific symptom that जब मैं मुंबई जाता हूँ तो बिल्कुल अर्टिकेरिया बंद हो जाता है. My skin is एकदम perfectly normal whenever I am in Mumbai or in Chennai. Then that's the most characteristic symptom that you can get for selection of the remedy. So you can think about all these symptoms. So for all these symptoms, we can check what are the most commonly used remedies. As I said, there are multiple remedies that can be used. I typically present the remedies that I have used, like a Shabri who has tasted the bear, और उसके बाद ही she offered them to the god. So I will offer only those berries which have been tested by me and which I have found working, useful and effective. And these are the berries that I can share with you. The first and foremost and the most common remedy, if you don't get any symptom, if you just get an itching and burning, which is better by cold, which is the most common symptoms of urticaria, Apis helps. It has 4S. There is a swelling, there is a soreness, there is sensitivity, and there is stinging pain. The burning is better by ice cold application, and there is a sudden puffing. The patient typically gives a history of sudden puffing or sudden appearance of the hives. So Apis is one of the most common remedies. Almost 60% of the patients, 70% of the patients, they feel better with Apis. The potency changes from patient to patient, it depends. But even the lower potencies have worked really very well. And in some patients, I have used the higher potencies in infrequent doses as well. The second most common remedy is arsenic album. Typically, chilly patient, Apis will be hot, arsenic will be chilly, but still they will have burning and there will be a lot of restlessness. So restlessness marks arsenic. So they are restless and anxious, while as Apis they are usually irritable because of the pain or because of the complaints. Arsenic is worse by cold. Now this is very peculiar of arsenic and it's worse with scratching. So if a patient gets burning which is aggravated by cold, they feel they are better by warm applications. And when they have a restlessness, you can think about arsenic album. What are the other remedies? I have not used Bombix still yet, but I had to mention this because right from the childhood, the first experience of urticaria or the allergic rash that we all as a child we experienced that because of the caterpillars. We always had caterpillars around us, survanta as we call in Marathi, and whenever we used to touch them, typically it used to give a complete rash over all over the body, and that used to be a very annoying experience in the childhood. So we have in homeopathy we have a remedy called Bombix, which is prepared from caterpillar, and it has a typical allergic rash that is very annoying, that comes all over the body. So somebody can think about Bombix and somebody can keep Bombix where somebody who is working around the jungles or somewhere where there are lot many trees and these caterpillars are very common, and you get patients which get affected by the caterpillar, what getting exposed to caterpillars. You can keep this remedy handy so that you can help the patients. Then these are the next remedies that are aggravated by undressing: Cocculus, Drosera, Kaliars, Calibacrum, Natrum sulf, nitric acid, oleander. Oleander was the first remedy I used because the patient typically gave a history that जब मैं कंपनी से आ जाता हूँ घर पे और जब मैं कपड़े बदलता हूँ तब स्पेसिफिकली आर्टिकुलर रैश ट्रिगर हो जाता है. So earlier I used to feel कि it can be because of the sweating, it can be because of the the exertion during the day. But he typically gave a history that whenever I change clothes, whenever I undress, typically that's where the itching starts. So oleander was the first remedy that I used, and then I found out that there are so many other remedies as well who represent this. The typically the then you check onosmodium, that has typically the opposite modality, which is they are better by undressing. So whenever they are dressed, the itching starts, and they are better when they are least covered. So good for the fashion people, they are least covered. So they will feel better with uh, they are the onosmodium people. As I said, seashore, causticum, medorhinum, and carcinosin. These are the people who are affected by seashore. They they show specific uh, modalities that are key with the seashore. Perspiration, manganum, merxol, and rhododendron. They are worse with perspiration. So whenever the perspiration comes, the urticaria comes. So these are the remedies. Soranum is another key remedy. Uh, that's exercise and perspiration. Bovista, if you read Bovista, that's one of the more common remedies that I have been using now. They are aggravated after bathing. So typically, a patient gives you a history that after I take a bath, I start getting this urticaria. I use Bovista, and that gives me a very good result. They are aggravated by excitement as well, and typically they are aggravated after waking. They typically present with a chronic kind of urticaria, and it can be associated with rheumatism, palpitations, and diarrhea. I had a few cases earlier which I couldn't resolve, uh, which gave a history or which gave a symptom. Like there were wheals, there were hives, there were puffy eruptions on the body, but there was complete absence of any kind of itching or burning or no symptoms. Uh, I had searched a few remedies, but in the repertory or in this thing, but I couldn't find specifically. Thanks to the applications like Homepath, where we can search a specific symptom or a specific word from Materia Medica, and I found URC as the remedy which covers this. That there is an urticaria without itch. So उसके बाद I got one patient who gave a history that there was no itching at all, but there were urticarial hives. I gave URC and it worked well. It also has urinary concomitants. I'm yet to get any patient who had a urinary concomitants with urticaria and without any itch. But I have treated one patient after two or three unsuccessful attempts because I didn't know the remedy. But after that, one patient who gave a history that he didn't have any itching, but just the wheals and thus the hives, URC worked really well in that patient. What else you can suggest or you can do in in these patients? You help ask them not to scratch because scratching will can aggravate or can trigger the further articular rash. Cool or cold compresses can be used to at least soothe or relieve those itchings. Cotton clothes that are loose fitting can be advised because the tight fitting friction can be one of the most triggering factors for urticaria. Keeping a good hydration, drinking enough water is one of the key factors in the treatment for urticaria. And always ask the patient to observe themselves and keep a journal about what triggered the urticaria. Typically, in a case of urticaria or hives for a homeopath, the most characteristic symptoms will be something that triggers the rash or something that modifies or that so the modalities and the causative factors, because symptoms they have not much to offer. There will be burning or smarting or piercing, that's all. But the most characteristic symptoms that you can find out will be in the ailments from the triggering factors and the modalities. They can be aggravations, it can be ameliorations. So ask the patient, I always ask the patient to keep an observation. When a patient gives me not many symptoms in the first uh, visit, I ask them, because they are not used to observing themselves, because they are used to taking anti-allergic tablets. So they haven't experienced homeopathy yet. So they don't know what kind of case taking that we need. So I ask them to observe. I tell them to observe and keep a journal, like what they had eaten on that day. If they get an allergic reaction on a particular day, they should write down whatever they had come in contact with, whatever they had eaten on that day. And if they find any pattern, then that can be helpful in the next visit. So this was allergic urticaria, hives or nettle rash, and their homeopathic therapeutics. If you want to know more and more about homeopathy, you can suggest me what are the topics that you would like to you would like me to cover in the next videos. For the therapeutics, we will be starting with drug pictures as well as the new playlist. So we are starting with drug pictures, which can help with first to final year students to write their exam papers. So you can suggest me which remedies you want me to cover in the drug pictures as well. And for more videos on homeopathy, health, and bachelor remedies, we already have a series of bachelor remedies in Hindi, Marathi, and English. So you can search that in the playlist of this channel. But for first, please subscribe to this channel and share this channel with your interested friends. Thank you.